Welcome to today's class session for NSC 508. In today's class, we'll be discussing Unit 4 of Module 4, which is the last unit under Module 4, and it is titled Apply Nursing Informatics to Nursing Administration, Nursing Research, Nursing Practice, and Nursing Education. The learning goal for this Unit 4 of Module 4 is for learners to be able to explain the application of nursing informatics to nursing administration, nursing research, clinical practice, and nursing education. Applying ethics to informatics. What does it mean? The application of nursing informatics can be described as follows. 1. User liaison. A nurse in this role is involved in the installation of a computer information system and interface with the system vendor, the users, and the management of healthcare institutions. Product manager. The nurse in this role is responsible for constantly updating a current product and keeping abreast of new developments in the field of nursing. They develop applications like decision support systems, nurse staffing systems, scheduling systems, as well as bedside and handover terminals. The next is clinical systems installer. We are looking at applying ethics to informatics. So we've looked at user liaison, we've looked at product manager, and we are now going to look at clinical systems installer. In this role, the nurse works with the vendor who sold the computer systems to the healthcare institution. He or she, I mean the nurse now, helps train users of the system, serves as liaison between the healthcare institution and the vendor, and works closely with the system coordinator for the healthcare institution. Systems programmer. The nurse in this role works in the information system department, analyzing and maintaining the system. Other roles of nurses in informatics include Chief Information Officer, Nursing Informatics Consultants, Network Administrator, and Clinical Information Liaison. In Nigeria, we know that nursing informatics is a new specialty and therefore should cover major sectors of healthcare system where nurses work. This includes the clinical, administrative, research, and education areas. So we are going to be looking at application of nursing informatics or applying informatics, ethics informatics in the area of nursing, clinical nursing practice or clinical nursing, nursing administrator or administrative, nursing research, as well as nursing education. So the first we want to look at is nursing clinical practice. Apply nursing informatics to nursing administration, research, practice, and education. These four areas interrelate to deliver evidence-based practice. The importance of nurses in informatics functioning in these sectors is outlined as below. Like I mentioned earlier, we apply it in four areas in the context of our own system, which is Nigeria that we are talking about, in administrative nursing, in clinical nursing, in education, as well as in research. Clinical nursing clinical practice. In nursing, as with healthcare in general, informatics is being used to address the challenges of the day, significantly impacting the way nurses functions in patient care. One of the primary ways that informatics has changed nursing practice is through documentation. Gone are the days of proper charts where we chart in the papers that had to be meticulously updated with handwritten notice. Today, nurses are more likely to input notice notes into electronic health records and other systems that keep a patient's medical history up to date and easily accessible. The Health System Information Management System Society reported that as the result of electronic charting, that is, with the invention of nursing informatics as a specialty in nursing profession, nurses are able to obtain information quickly and efficiently using the information to improve the daily workload. We can see that this is improving the work of nurses. Storing the information electronically is more easily available to all members of the care team, including the physician and other care providers, as well as staff teams at other healthcare organizations that the patient may visit. In the United States of America, population is becoming or has become more, population becomes more mobile. It is increasingly important that their personal medical records can travel with them to any office or medical organization they may visit during their lifetime. So we've seen here that in US, their health system is mobile. Wherever a person is, their information or their medical history or their medical information or records can be traveled or can be sent to them or can be accessed to any healthcare personnel who is taking care of them irrespective of their location. Nursing informatics is also an important part of care coordination in nursing. The ability to track staffing, workflow, and communication can help nurses to identify areas where current processes can be improved. This can also help ensure that staffing levels remain adequate which is critical for providing patients with the best possible care. If the nurse to patient ratio drop too low, patients are more likely to suffer adverse results. Maintaining adequate levels help nurses provide the best possible care each day without burning out. So we've seen the importance of nursing informatics application or applying to nursing clinical practice. In applying it, we also look at it that it helps to provide a work list to remind staff, that is the nurse staff, of plain nursing interventions, electronic medical records, and computer-based patient record. Monitoring devices that record vital signs and other measurements directly into the client record. Computer-generated nursing care plan and critical pathway. Automatic billing for supplies and procedures or procedures with nursing documentation. Reminders, that is, it reminds and allow prompts the staff nurse that appear during documentation to ensure comprehensive charting. So we've just finished application of applying nursing or applied ethics informatics to nursing clinical practice. Now we are moving to or discussing nursing administration. What do we mean by ethics informatics application to nursing administration? It simply means it's a broad term that encompasses nursing professionals who are knowledgeable of leadership practices as they relate to nursing profession. The Journal of Medical Library Association defines nurse administrators or nurse leaders as those who design, manage, and facilitate patient care delivery within any type of healthcare settings. Nursing leadership professionals must be able to develop a successful vision for the nursing organization and nurture collaborative relationship among interdepartmental staff and management in an effort to implement that vision. Nurse leaders must apply analytical and problem-solving skills on a daily basis and provide direct guidance and mentorship to their unit nurses, often acting as a liaison between staff, various levels of management, and the hospital's executive team. Nurse administrators are often responsible for large-scale policy planning, staff management, financial resources management, and business management, in addition to their core responsibilities of coordinating and supervising the delivery of healthcare. Below are some of the applications of nursing informatics to nursing administrators. Automated staff scheduling, email for improved communication among departments, cost analysis and finding trends for budget purposes, quality assurance and outcome analysis. Nursing education, in relation to ethics informatics. Nursing informatics facilitates the integration of information, data, and knowledge to support nurses, patients, and other providers in their various settings and decision-making roles. The foundation of knowledge model specifically promotes nurses to extend their theoretical metaphoric knowledge into practical holistic determination based on a variety of factors and contexts. Because competency in informatics includes but are not limited to information literacy, computer literacy, and the ability to use strategies and application to manage data, knowledge, and information. The ability of nursing students to use computer-mediated communication skills is essential to their success in the nursing field and as a means of improved patient safety. The rise of telecommunication, computer-mediated communication, and virtual technologies has opened up opportunities for improving communication and extending care within the healthcare industry. Proponents of instructional applications of computer technology view this as a way to erase geographical barriers to students, enhance the presentation of content, improving learning outcome, and even tailored instructions to individual learning needs. When carefully matched with curricular objectives, technology becomes an efficient and affordable avenue through which nursing faculty may provide useful knowledge to their students. Now going forward, beyond simple applications of word processing software or spreadsheets, technology applications have evolved greatly, taking advantage of modern capability to provide nursing and related healthcare students with stimulation, complex multimedia, virtual reality assisted clinical scenarios, and a host of information and literature gathering internet tools. Application of nursing informatics to nursing education. Computerized helps to computerize record keeping, helps to computerize assisted instruction, helps to interactive video technology, that is telenursing, distance learning web-based courses and degree programs, teaching and presentations. We looked at nursing research. Nursing research has involved with technology. There is no doubt about that. In this era of evidence-based practice, clinicians must continue to think critically about their actions. What is the science behind intervention? Things must no longer be done a certain way just because they have always been done that way. Instead, one should research the problem, use evidence-based resources. Research helps nurses determine effective best practices and improve patient care. Nursing research has involved with technology. Nursing informatics therefore helps to enhance and facilitate collaboration, improve access to online libraries, critically select electronic and non-electronic references, consolidate the research findings, and combine and compare the conclusions, presenting the findings and propose a solution. Nursing research is conducted to generate knowledge that is used to meet the needs of healthcare delivery systems, organizations, nurses, and patients. Through nursing research, researchers generate knowledge for nursing profession. Knowledge generated is extremely important in the advancement of nursing program. Classification of nursing research. Basically, we have two uh, ways of conducting research in nursing. They are quantitative research and qualitative research. I think under Unit 2, we discussed Unit 3 or Unit 2 there, but I think it's Unit 3. We also touched this nursing research. And so we've seen that basically what is common that you will see is actually quantitative research, especially at undergrad level. And what does it mean? It's a logical paradigm that look at positivism and focus upon outcomes for clients that are measurable, and generally they use statistics. While qualitative research is based on the paradigm of phenomenology, grounded theory, ethnography, and others. So under qualitative, you basically do phenomenology, grounded, and ethnography, and examines the experience, where you are examining the experience of those receiving or you are delivering nursing care to. So in this type of research, which is qualitative, what we actually look at is the meaning of or the experience of a patient, in particularly what it means to them. And so we've seen that this also is very, very essential, because this research method mostly are used, the method or the tools or the instrument are basically interview, case study, focus group. How do we apply it in the context of nursing ethics informatics? It helps us to computerize our literature search. It helps us to also retrieve evidence-based practice, adaptation of standardized language related to nursing terms, as well as help to find the trends in data that we have gotten. And lastly, knowledge-based internet improvements. In conclusion, nurses spend a significant proportion of their time on information-related activities as part of clinical decision-making in order to lead, coordinate, and support the delivery of safe, effective, person-centered care. Hence, nursing research, nursing education, nursing clinical practice, and nursing administration is a necessity for the development of nursing practice, since nursing informatics is a new specialty in nursing. Thank you for watching. See you in the evening for our live class session. God bless.